Hey, welcome back to part 2. I didn't lose you yet anyway. Okay, so we talked about the kinds of hospitals in the first one, and now we're going to visit about the structure of a hospital. And the reason why this is important is as you progress through the program, they will talk about these people, and everything you learn from here on out, they're going to assume that you know who everybody is that they're talking about in that hospital structure. So we don't really talk about hospitals much throughout the rest of the program, but you read about it all the time and what they do. So the corporate structure. This is something that people love to write test questions on now and in the future. So not a lot of tests in this class, but they do write tests on your questions on your national accreditation exam. So in every hospital structure, there is what is called a governing board. And the governing board is also called the board of directors or an executive council, whatever they call it, but they serve the same purpose, and that's to provide oversight. You'll also see a chief executive officer. Their job is to oversee daily operations of that facility. Then you have administrators or the administration, and that can be department heads, chief officers, patient care managers, whatever their titles are in the organization. You will have a medical staff, and you will have ancillary personnel who provide healthcare services. Then you got the non-medical services that are critical, your custodial, your maintenance, your laundry, your dietary, all those persons. And then you have your business offices. So there's a lot of different components to a hospital structure. Here's an example organization chart. It's not the best one, but when they say management up here, that includes the board of directors way up here at the top, and then you've got your CIO, your CEO, your chief executive officer, and you have your medical staff. And notice how the medical staff is out there all by themselves. Remember, that's because medical staff have their own bylaws and their own organization. And they're melded in with that hospital, but they're also standing there because they provide the medical services. We have nursing, clinical support, ancillary information services, facilities management. So here we are. This is our little block right here. And information, admitting, medical records, information technology. So hospitals can be organized by their functions, or they can be organized by their size or by their type. But the governing board, I'm going to go back to that. The role of the governing board, their job, they hire that chief executive officer who runs that hospital. And that chief executive officer, they report to the governing board. When you are on a board at a hospital, it is a voluntary, unpaid position. So they are not paid. And it's a lot of work to be on a board, and it's a lot of responsibility. The governing board is the entity who is overall responsible for that direction of the hospital. They're the ones who approve the strategic plan. They're the ones who establish bylaws. They're the ones who select that qualified administrator. They approve the organization of that facility and how staff is made up, and they're responsible for monitoring quality of care. Now, that doesn't mean that they're in the hospital doing the hands-on work. People report to them, but overall, the decisions that they make and or approve give them overall responsibility. So, a member of a governing board can be sued. So most members of a governing board, the facility where they volunteer at, does take out liability insurance in the event that that would happen. But it's a lot of responsibility, and you get a lot of input from the public and the staff, and it's a lot of responsibility, but it's also quite an honor to be asked to serve on the board of directors. So here's your hospital management. You have your chief executive officer, your chief operating officer, chief financial, chief medical, chief information, and chief medical information officer. We're going to go through each of those roles a little bit. First, the medical staff. Your medical staff usually has an elective chief of staff. The job of the medical staff is to get bylaws established, but they manage physician privileges. Now, what they mean by privileges, in order for a physician to practice at a hospital or a healthcare organization, they have to be granted privileges to perform care there. You can't just take any doctor off the street and say, hey, I want to admit you to this hospital and I want to admit you there. No, they have to apply for privileges. They have to be approved, and their approval comes from the medical staff. They provide governance of the medical staff, and they also provide continuing education. Now, in a medical staff, there are different classifications. So if you go in a hospital, sometimes, you see a wall and picture of all these physicians. That doesn't mean every one of those physicians are there at that facility. They might have different status. So an active medical staff, that's someone who's active. They got admitting privileges. They provide care there quite routinely. A provisional is admitting privileges. Once in a while, you can provide service there, but you're not one of our regular doctors, but you can do that. An honorary staff member is usually a physician who's retired, but they're still part of the staff. They're usually not active in patient care, but they play a vital role in the medical staff because they're honorary. They have years of experience and they have good input. You can have a consulting physician, so they just come in and provide consultations for patients and then they leave. A courtesy would be like a visiting physician, and then you have medical residents. Now, this information is in your textbook, and it's important you know because, like I say, on your RHIT test, they're not going to ask you about these medical staff classifications, but they might put it in there like Dr. So-and-so is an active part of the active staff at so-and-so hospital, and what is this physician allowed to do? Other hospital personnel, they have surgeons. Surgeons perform our operations, sometimes special types of operations, like they specialize maybe in orthopedics or plastic surgery or maybe obstetrics. You have an anesthesiologist. They're the people who monitor patients in the operating room and treat pain. You have physician specialties like internal medicines, cardiologists, gynecology, psychology, medical subspecialties, RNs, and pharmacists. So every hospital has a nursing staff. They usually have a chief nursing officer or a director of nursing. And then they usually have nursing units. So you might have nurses that are just assigned to the ambulatory care or outpatient. You have nurses who provide inpatient or maybe only ICU care or critical care. Usually a nurse can specialize in those areas. Nursing units, then hospitals also have to provide education, professional development, and research. So, overview, hospitals contain specialized areas. So, for example, inpatient care is usually done in wards. Immediate care is usually done in the emergency room. They do surgery in the operating room. Critical care is in the intensive care units or critical care units. And they can employ specialized personnel to assist with health care. So your clinical support services in a hospital varies. You have diagnostic support, so those are your x-ray departments or radiology. Or you might have a cardiology department where they do cardiac stress test or echoes. You can have therapeutic departments. Therapeutic means you're treating an illness or an injury. So that would be like your physical therapy department, your occupational therapy department, or your pharmacy. And all hospitals have a social service function. People who provide care, like in emergency medicine, their goal is to save lives, but emergency medicine is just short-term care. So these people who receive that might be EMTs, emergency medical technicians, or paramedics. Emergency room care can also be a physician's specialty, such as an emergency care room physician. Every hospital has an ER. To be classified as an emergency room, they have to be open 24 hours a day, 7 days a week. And they can treat every kind of illness from an ankle sprain to drug overdoses. But when you get a serious injury come in, they perform a service called triage. Patients then are either treated completely or they can be transferred out, but they can't be transferred out until they're medically stable. Surgeries are done in the OR, and those are some of the requirements for the OR. And then they also have surgery centers. They function as ORs, but those are a little bit different. Sometimes they're freestanding and not part of a hospital, which we'll get to on our next week, but they do outpatient operations. You have ICU and CCU. ICUs treat people with severe disease or injuries, and a CCU is a cardiac care unit, and those are for cardiac heart disease. Usually patients come from the emergency room, the operating room, or another hospital to be admitted into these levels. They do all kinds of different interventions, and the equipment is very sophisticated. So usually staff who work in this area are very specialized. This is a little bit of the ancillary services that you'll see in a hospital. Your clinical support, you'll see the list there. You have the administrative support, where you'll see the list there. And then you have ancillary personnel. And if you look at this personnel list, we'll talk about this more when we get to the week for healthcare workforce. But most of these all have to have some kind of specialization and training. Then you have facilities management services. And then you have information management services. So this is where we fit in. And then they talk about the different kind of data types that all personnel work with. Paper records, measurements, recorded signals, drawings, photographs, and images. Different ways we communicate in the hospital. Different types of patient experience. We talk about the hospital, but the patient experience. You know, what's their history? What tests were done? How do they get access to information? So this is a little bit about the hospital. It's a lot of information. Again, read your transcripts. Make sure you understand it. Review your PowerPoints. Next week, we're going to be looking at ambulatory services and hospital outpatient services. Have a good week and good luck on your assignments.